So calling someone a cosmetic surgeon or someone calling themselves a cosmetic surgeon is kind of like them deciding to call themselves a cosmetic surgeon. There's no way to prove that they are actually fully trained in cosmetic surgery because it's not one of the surgical specialties within the Royal College of Surgeons. So plastic surgery is something that you can see if someone's trained in that. How, I hear you ask? What, you're asking me how you can see if someone's trained in plastic surgery? Well, the way they do that is, you get the book, okay? If you want to know if someone's a fully trained plastic surgeon, you get the book, Never Accept a Lift from Strangers, How to Choose the Best Plastic Surgeon for Your Cosmetic Breast Surgery, Okay, so I've written a book on it. Yeah, that's right, you heard me. I've written the book on it, mate. All right. The book has been written by yours truly about how to choose a plastic surgeon. And it talks about surgical training and subspecialty training. And so, it's cosmetic surgery is only something that people kind of make up and call themselves cosmetic surgeons. And it's not something that is a defined specialty within the Royal College of Surgeons. There is no training scheme for cosmetic surgery. Well, there is an accreditation thing that's just been recently brought out, but in terms of having a qualification, in terms of being on the specialist register with the GMC, the General Medical Council, there is a specialist register of plastic surgeons. There is no specialist register of cosmetic surgeons. There's also a specialist register of ENT surgeons and eye surgeons and general surgeons and orthopedic surgeons and cardiothoracic surgeons and all the other different types of surgeons. So anyone who is a fully trained surgeon, so that's one of the things I go on about the book. Unfortunately, a lot of people out there are doing this who aren't fully trained in anything. And there is also a lot of people out there doing this sort of stuff who are trained in surgical specialties who you might not think would be the right one for doing the procedure that you are inquiring about. So it's important to, first of all, make sure your surgeon is fully trained, number one. So go on the GMC website, GMC-UK.org, I think it is. If they've got a funny name like me, Staiano, you can search on their name. If they've got a normal name like Smith or something like that, you might need their GMC number. We're all encouraged to share our GMC numbers. 411-7214 is my GMC number. So if you search on the GMC website for Staiano or 411-7214, you will see that I'm on the specialist register for plastic surgery. So I am a fully trained plastic surgeon. The other way you can check is by looking for these letters after the name, FRCS Plast. Where are they? There they are, FRCS Plast. So FRCS means you're a fellow of the Royal College of Surgeons. Plast means you've got a subspecialty qualification in plastic surgery. So an ENT surgeon will have FRCS and then in brackets ORL, which is otorhinology. A general surgeon will have FRCS and then in brackets Gen. Orthopedic surgeon will have FRCS in brackets Orth. So if they have only got FRCS and they haven't got anything in brackets after the FRCS, that would suggest they're probably not fully trained. Now, I say probably not because that brackets thing came out. I don't know when it came out, to be honest with you, but basically, if they're very old, older than me, then they might be on fully trained in a specialty but not have that specialty fellowship. So they could be very old, but if they're not very old and they haven't got anything in brackets after their FRCS, then the likelihood is that they are not fully trained. But you can check on the GMC website, as I say, because it'll say on the specialist register for plastic surgery since whatever the day is. So plastic surgery is a specialty. Cosmetic surgery is not a specialty. It is just a name that people give themselves when they're doing cosmetic type work. And as I say, there are lots of different types of surgeons who legitimately do cosmetic surgery. As I say, ENT surgeons do nose jobs and ear corrections perfectly, which is perfectly fine because they're trained in those areas. Just like eye surgeons are trained to do blepharoplasties, plastic surgeons do them as well. So plastic surgeons do ear corrections and nose jobs as well as eye, blepharoplasties. But so there's a bit of crossover with plastic surgery. We tend to do soft tissue work, so we work on the skin and soft tissues all over the body. So we do have crossover with other specialties where we do work either together or we both do the same sort of thing. So yeah, that is the difference between a plastic surgeon and a cosmetic surgeon. And that's cleared that up. Can you have a second breast reduction if your nipples were free grafted in the first procedure? Blimey, that's a good question. Well, I mean, I've never done it. Full disclosure. Could it be done? I mean, you would obviously, or maybe not obviously, you'd have to free graft it again. You would there'd be no point in trying to do a pedicle in the second procedure. I would have thought, I suppose you could do a pedicle if the nipple's got blood supply. Actually, yeah, you could do a pedicle, couldn't you? But the pedicle's not like a normal pedicle, is it? Crikey. Times like this, you wish you'd done a bit of research before that thing. I mean, you couldn't do a big one. You couldn't do a big breast reduction. Another. I mean, a free nipple graft by almost by definition means it's been quite a big breast reduction. I only do free nipple grafts when they're really big breast reductions. So you wouldn't be able to do another big one. You would be able to do stuff to the breast for someone who's had a free nipple graft. You would be able to move some volume, particularly if the volume is in the lower pole or laterally or in a certain area, and the nipple didn't actually have to be moved. Because often with a breast reduction, the nipple is moved to a better position. Not often, always, but the nipple's moved to a better position. And so if the nipple's in a good position and you don't need to move the nipple again, then there's less of an issue because the whole issue is about the blood supply of the nipple. If it's taken as a graft, could you then move it again? I wouldn't want to put it like that. I wouldn't want to move it again, but there are certain things I could do to reduce volume from the breast. If it wasn't a nipple position problem and just volume, maybe as I say in the lower pole or laterally, too much at the side, then that could be done. But actually, if there's a droop and that nipple needs to be lifted again, I would be worried. I would be anxious about it personally. And it probably could be done, but you wouldn't want to move it too far. Yeah, good question, that. Nice one. Whoever asked that. Can you remove a boil? I normally say we can kind of remove anything, but there's a lot of stuff we don't do, and I guess boil would be in that category. A boil is an infected thing, and usually with the boil, the treatment is to release the evil humours, so lance it or incise and drain it, so let the badness out and then let it settle. If there's inflammation or if there's a cellulitis or an infection around the skin, that might need antibiotics, but the mainstay of treatment is to just sort of let the bad stuff out, and that doesn't really need to be plastic. That wouldn't be plastic surgeons. What have I done? Sorry, I was trying to. More likes can be attracted. I like to live. I like my own live. All right, okay. Didn't mean to do that, but there you go. So yeah, we wouldn't. And the answer is, if you contacted us with a boil, we'd say get it. You would maybe go to your doctor or get some kind of emergency treatment for it in terms of antibiotics or drainage. And if once it's all gone, there is a residual lesion, commonly a cyst, we can certainly remove that cyst, but we wouldn't do it while it's infected, while it's in boil mode. We would wait until the boil had gone. So yeah, So no, we wouldn't remove boil, I suppose, is the short answer to that, which is what you're after, isn't it? Let's be honest with ourselves, because we've got lives to lead. So let's just get to the short answers. Alarplasty. Do we offer alarplasty? Do we offer alarplasty? Um, so alarplasty, a bit of a vague term. What do you mean? It's a bit like umbilicoplasty. So umbilicoplasty is sort of changing the shape of the umbilicus belly button. It's like, well, what do you mean? What's wrong with the shape of your belly button is the question. So alar is this part of your nose, the sort of rim of your nose. So alarplasty is sort of changing the rim of your nose. So it depends on what you want doing. The bottom line of that question, I would say, is that's around a rhinoplasty or a nose job type of question, and we don't really do nose jobs, or at least I don't do nose jobs. Some of the other surgeons at the clinic do nose jobs, but it's not really something that we specialize in at the clinic. So I would say no is the easy answer to that. But having said that, if you send us a photo, tell us what your problem is, we'll see if we can help you or not. We'll be honest about that. But if it is a nose shape issue, then that would be I'd say no, because but as I say, we have got surgeons who do noses, so they might be able to give you advice, or they might actually be able to do it. But noses is a sort of specialist field, which is not really where I've been focusing on with the clinic. It might be something that we'll move towards, it might not, I don't know. I'm quite sort of comfortable just doing the minor ops and the sort of stuff I do, which is breast and tummies, but that's sort of most of the work that we're doing at the moment. Help, right? So better get on with it. The natives are getting restless. So what have we got? I have a lipoma on my forehead, and I'm worried that after removal I lose sensitivity of the area as some nerves going through. Could you please explain if it will be the issue? Yes, this is something that I've a patient with a lipoma or a lump here on their forehead, and they're worried about this. So the answer is, yeah, there is a risk. There's a couple of nerves that go the medial aspect of your eyebrow. There's two nerves that go up, go up to your scalp. They're called the supraorbital and the supratrochlear nerves, and they go up and they supply sensitivity of the scalp here. And if you have a lump in that kind of area, there's a chance that that nerve might be damaged. So it might just be pushed or pulled, it might be hit by the local anesthetic, or it might be cut. If we're removing the lump, it might be cut. And the nerves are very fine, and sometimes you don't see them. And so there is a risk to that. And if that happens, then when you comb your hair or run a brush through your hair, you'll get funny feeling in a sort of strip of your scalp. So that is a risk if you're doing things in that sort of area, in that sort of domain above your medial eyebrow, above your medial eyebrow, because the nerves come out from your the brow, and they go up and supply the skin to the scalp. I mean, they're sensory nerves, so they're not motor nerves, so it has no effect on the movement of your eyebrow or the movement of your forehead or anything. Those nerves come in from the side, but the nerves supply the sensation to the scalp come in from there. So that is a risk if you have a lesion in the sort of line from the medial eyebrow up. So that's something that we talk about, and that's something that you'd have to feel comfortable with taking on if you wanted to have that lump removed, because if you think that would basically, if the lump's not that bad, then you might say, well, forget it, I'm not having it done because I don't want to have a numb piece of skin on my forehead or on my scalp, really, it supplies the scalp. Then that's fine. Don't go ahead with the surgery, because that's a potential. Not normally a big problem. Never met anyone who's a big problem for, and it's not a common thing, but it's out there, I suppose. Do we remove PIP implants? Yes, we do. Will there be an extra charge for removing them? No. PIP implant. This is going back a bit now. They were advised to be removed many years ago. I can't remember how many years ago when that PIP scandal came out with that chap in France who was using non-medical grade silicone for the implants, and so that was a big news story at the time. I think he's in prison now, so yeah, they were advised to be removed. So yes, I've taken loads out. Never put them in, fortunately, never used them, but often see people who had them done elsewhere, and we would be happy to remove them. And there's not an extra charge for removing them. No, that's just the normal charge for removal of implants. There's nothing particularly special. They did have slightly thinner walls, so they had a higher rate of rupture. So they are often ruptured, but that's okay. We can deal with ruptured implants. They had quite a low rate in my experience. I don't know if it's published, but quite not very commonly um, having capsular contracture. They were quite often quite soft, which is a good thing. Not having capsular contracture is a good thing. Rupture is not a good thing. But bottom line is, yeah, we can remove them, no problem at all. And the fact that PRP is not a problem in terms of the charge is the same as whatever the price for a removal of implants is. It's yeah, same. Yeah, so that's that. That's all I got. To be honest with you, that's all I got. Got no more. I've got no more questions, Your Honour. So on that note, I'm back now. I will be back next week, Tuesday, 7 o'clock. Hopefully, I'm going to leave my computer on now, so hopefully it won't take 25 minutes to start up. And so I will be back at 7 o'clock ish next Tuesday for more of the same thrilling questions. If you've got a thrilling question yourself, call me, email me, message me, and I will put it on the list for next. Well, I'll answer it first off the bat, and might put it on the list. I'll put them all on. Just put the interesting ones on, as you can tell how interesting those questions were. I think you can all agree that that was a very interesting, lively debate that we've had. So yeah, if you want to join me for another lively debate next week, then you know where I'll be, and so secure your spot by turning your computer, your phone, your tablet, or whatever device you access the World Wide Web on, and do whatever you just click the button and yeah, see you then.